The doctor is in today, and we are discussing heartburn. Whether you've overindulged in a spicy dish or a feast of fatty foods, it's extremely uncomfortable, yet an extremely common condition. Dr. Scot Ackerman is one of the First Coast's leading doctors. He is joining us today to talk about what causes it and how you can get fast relief. Dr. Ackerman, thanks for being here once again.
Thank you, Casey. It's good to see you today.
I think everybody has had heartburn from time to time, whether it's induced by people or if it's induced by foods. What exactly causes heartburn?
Absolutely. Everybody gets a little heartburn sometimes. As soon as you eat and food goes into your stomach, acid is secreted into your stomach to help break down the food. And between the esophagus and the stomach, there's a sphincter. It's a muscle that tightens up and relaxes, and it relaxes to let food into the stomach. And then it closes up and tightens up. It forms like a valve. And excuse me. And this keeps food and the acid from sliding back up into the esophagus. And if this valve is faulty and food comes up into the esophagus when it's being digested and it's in a highly acidic state, that causes what we call acid reflux or gastroesophageal reflux.
Can heartburn ever indicate a more serious problem, or is it just an annoyance?
Well, it is, for most people, thank goodness it's just an annoyance, because as I said earlier, everyone gets occasional heartburn. But if it's persistent, it could be something more serious. We call this persistent reflux, we call this gastroesophageal reflux disease, or GERD. You might have heard the word GERD,
yep.
And that's a chronic case of acid reflux. And when you're having this reflux into the esophagus on a chronic basis, it leads to ulcers, it leads to scarring in the lower part of the esophagus, and it also puts you at increased risk for esophageal cancer.
Right, and we were just talking a second ago about the awareness commercials that are coming out about Barrett's esophagus, talking about if you're not getting treatment for heartburn. And that leads me to my next question. All the medications that you see on the market, you see all these commercials, you'll see like Tums and Rolaids, but then you'll see more, advanced medications. What's the difference between all of those?
Well, there's basically three different types of medications that we prescribe to patients or patients take for heartburn. The first is very simple. It's an antacid, and antacid neutralizes the acid in the stomach, so it's not really absorbed systemically to go through the body. It just goes into the acid and neutralizes it. It changes the pH of the acid. And these are simple things like Tums or Alka-Seltzer, those sort of things, which you have a little bit of indigestion, you take that, it'll neutralize the acid. Then the second two groups, or the second and third group rather, are medications actually that go into your blood system and reduce acid production or eliminate acid production. The first group are drugs that we call histamine 2 blockers, or H2 blockers, and they reduce acid production. You may have seen some of these in the supermarket. They used to be prescription, but now they're available in the supermarket, drugs like Pepsid or Zantac, or in the pharmacies, wherever they're over the counter. And then there's other ones that completely block the production of acid in the stomach, and these are drugs we call proton pump inhibitors, and these are drugs like Nexium and Prilosec or Pepsid.
And you need a prescription for those?
Yes.
Yeah.
I think Prilosec you don't anymore. You used to. Many times these drugs are on prescription for a while, but then they come off prescription in a lower dose.
And I know there are some people out there that don't want to be taking a medication for a prolonged period of time, and they want to try to find a natural solution to trying to get rid of heartburn. Are there options out there?
Sure, there are. The Tums are things that are kind of natural. They're not really a medication that goes through your body, but there are other more natural things. First of all, I suggest if you have this reflux, and it's good to talk to your physician about managing it, because you don't really want to get out of hand where you eventually develop esophageal cancer or a problem long term. But you can do, I suggest to my patients who talk to me about having a little bit of reflux on occasion, I talk to them about what they could do to change their lifestyle to minimize the risk of this happening. And one thing is food choice. If you ingest fatty foods, you get a lot of acid production into your stomach. So avoid fatty foods, big steaks, those sort of things. Avoid very spicy foods or acidic foods as well. Also, if you eat smaller portions, you'll digest better, and you'll have less chance of reflux. If you eat a lot it all goes in your stomach and fills up your stomach, you're going to have a higher chance of reflux. So take your time, eat smaller portions, don't wolf your food down. Also, smokers have a higher acid content.
If you needed one more reason to quit smoking,
exactly.
you know, there's another. Let me ask you very quickly, because we only have about 30 seconds left. How important is it to take care of this condition if you have chronic heartburn? If you feel like you get it once or a few times a week?
Right. If you get it once in a while, I wouldn't worry about it. But when it becomes persistent and you're having it every day and it hurts to swallow certain liquids all the time, I would see a physician and do something about it.
All right, Dr. Ackerman, thank you so much for coming on, sir. We appreciate your insight and perspective every week for sponsoring this segment and for all the good advice that you provide. For questions regarding today's topic or any other health questions that you might have, you can connect with Dr. Ackerman on Facebook by visiting facebook.com/First Coast Oncology.